Okay, we're going to go ahead and get started today. I want to thank everybody for joining the Lima Allen County Chamber of Commerce and the Small Business Development Center for joining us on Topical Tuesdays. Kathy is here, however, she's having an issue with her mic today, so she won't be able to speak, so I will speak for her. And today we are talking about Responsible Restart Ohio for retailers. And with the governor's announcement today, we have Tammy with the Allen County Public Health Department on the line that will be giving a presentation, and she may talk about some of the announcements that were made for the following week as well today. You are muted, and if you have a question, please by all means use the chat box, and I will go through those at the end of the session. And I'm going to go ahead and turn it over to you, Tammy. Thank you.
Okay, great. Thanks so much for having us. I really appreciate the opportunity to talk with you and share the health department perspective on all that is going on. Want to start with just a general philosophy statement, I guess, for lack of a better term, that from the very beginning of this, with the original stay-at-home order that was enacted by the governor and the health director, the intent is for Ohioans to work with the order, not in spite of the order. And I can flip to the next slide here and show you, I think I can. There, are you seeing my next slide? No.
Nope. Not yet.
I am on mine. I'm so sorry.
That's
there
okay.
we go. Okay. All right. So, okay. So the spirit of the governor's orders are, and the guidelines are, to keep Ohioans as safe as possible. And that's been the goal from the very beginning. He recommends that we not look for loopholes or end arounds. We look for ways to work within the guidelines. And I'll be very honest with you. The enforcement part is not easy. Health departments were just as surprised as I believe business owners were when the governor, and particularly the lieutenant governor, kept announcing on their press conferences that if anyone saw any violations of these orders, please contact your local health department. Now, yes, we've always been set up to do inspections of restaurants and food establishments, but that has more to do with licensure and not whether or not someone is standing 6 feet apart from each other. So it was a new practice for us as well, and we learned as we went through it. An interesting comment that was made on one of the governor's press conferences a few days ago was that one of the criticisms they are hearing is that the general public just wishes that government would just trust them to do everything, for their own part. Well, Lieutenant Governor Husted response to that was, we do trust you. And in fact, we have to trust you to make these orders work so that we can get back to work and keep people just as safe as possible. So the trust factor is definitely there. Currently, the enforcement process has been that if an individual or a customer, an employee, a passerby sees something that they feel is not safe, they have been calling us, the local health department, and letting us know. And currently on our database of different organizations and businesses that we have received phone calls about, or emails or through our Facebook page, it's over 250 now, and that's unduplicated. We get several duplicated calls, whether it's different numbers of people calling about the same business, or if it's an individual who continues to call about the same business, we do get duplicates. But the number right now is over 250 individual. That includes churches, parades, those type of things. It's not just businesses, but we have received quite a bit of interaction from the public. So just, the public is watching. There's no doubt about that. Majority of the concerns are coming from employees themselves, particularly at the beginning of the first order, when there was still, when there was even more unknown about the virus than there still is currently. Some employees were scared, weren't sure why they had to be at work when it may not be safe. So they were calling and mainly wanting to know what can they do to stay more safe, or what should their employer be doing for them to stay safe. We would balance that with whether or not it was a true desire to work or to not work. We do get calls from customers as they go from store to store. One store, all the employees are wearing masks. The next store, maybe the other, they aren't. So, calls about that. Surprising amount of calls from family members, parents calling about their teenage child that works maybe as a clerk in a grocery store, spouses, parent or children of older parents that are maybe working part-time in places that were concerned about them. Get some calls from competitors who want to know why a similar business to theirs is open when they believe the orders to apply to them to be closed, as well as just passerbys. They drive by, they see something, they think, well, I don't think that's essential. I wonder if the health department knows about that. So they'll call and say, did you know that this business appears to be open? And in fact, I can tell you, we've had a few people, it appears that they literally drove around looking for this because the same individual perhaps made calls or contacts about some of them. That's why our philosophy behind enforcement is enforcement through education, because there are so many different angles a person can come from with a concern. We don't want to be the big bad guy that comes in and closes you down because someone said you weren't wearing a mask. It isn't like that at all. What we do is we get a notification, be it from one of these groups of people, that a business perhaps was not practicing all the safety measures they should. So we will send out a letter or an email, if we have it, to the business that just reiterates what the guidelines are and how you should be operating. And then we just ask for a response from you that you've received our communication, you understand the guidelines, and that these are the steps you will take to help improve the safety in your organization. So you certainly get a chance to tell your side of the story, as well as perhaps let us know some of the reasons that some measures aren't able to be handled. And there are some exceptions, and I'll go through those as we move through the different safety measures that are important. So some of the top complaints that we get, the number one is by far not practicing social distancing. This one has gotten better as the weeks have gone by. Businesses that have currently been able to be open have understood it better and have put into place, X's on the floor at the checkout counters, blocking off certain areas of the store that it's impossible to have more than one person be in if it's a little nook or a cranny in a business that wasn't made for a flow through. Get complaints about face coverings, and even though in the past week there's probably been the most confusion there has been over this, it has been a confusing issue from the beginning. In fact, as an example of how things change and evolve through this new virus situation, at the very beginning of this, the CDC, the Ohio Department of Health, and therefore us here at Allen County Public Health, were suggesting that people not wear homemade cloth face coverings, because at that point, the science was telling us that that might actually lead to more spread of the disease because you might touch your face more. Well, as we've learned more about this virus and the spread, and that droplets can survive with the virus on them on surfaces, now realize that face coverings are a protection for other people. So if you would wear one. So that has changed to where it is advisable that everyone wear face coverings. There are some exceptions to that in the workplace, and as I said, I will get to that in a few minutes. Other complaints we have are too many people in the businesses. One of the things businesses are supposed to do is take a look at the capacity in their building. And the rule of thumb that everyone is using and suggesting is that you probably have a capacity for your fire codes or your fire for your insurance. So 50% of that would be a good number to consider a safe number to have in your business. So if you know what it's been determined is the capacity for fire safety in your business, just cut that in half, and that's how many can safely be in your business with risk of COVID. We also get complaints about supplies not being handy. And these are the ones that tend to come more from employees, that hand sanitizers haven't been provided for employees that are out working with the public, and that there are not appropriate cleaning materials or wipes. So you still have a little bit of time before May 12th to open up, but if you haven't gotten a good supply of those items yet, I really encourage you. I know the Chamber's been working, trying to find steady supplies of those things so that employers can have them on hand and that their employees can feel safe. So. All right, last week, the governor came out with the Restart program, and he is calling it Responsible Restart Ohio. And the 3 guiding principles behind it are to protect the health of employees, customers, and their families, excuse me, and then support community efforts to control the spread and to have Ohio lead in responsibly getting us back to work. We're going to talk today, obviously, about that first one, protect the employees, the health of employees, customers, and their families. These are the 5 practices I've been referring to earlier that businesses must do to provide a safe environment for everyone, for customers, for themselves, and for their employees. We'll break down each one of these and take a deeper dive into them. But again, we're hoping that people see these as guidelines and how you can show your share and concern for your family of employees as well as your customers. The enforcement issue, again, as I said, is difficult. We try to do it through education. So again, that's another reason I really appreciate this opportunity to be here and talk with you. But let's tackle face coverings first. This is probably the one that's become more confusing. When the governor first announced the continue to stay at home, or the reentry restart process, his initial guideline was that everybody wears masks all the time, very similar to the no shirt, no shoes, no service kind of slogan. Over the several days after that order was given, he spoke to many different sectors of the population and realized that that was not a practical thing to have in place. So the language is a little looser. Basically, to comply with the state regulations, businesses need to allow customers, vendors, and other visitors coming into their facilities, need to allow them to wear masks. At the very start of this, we were getting some complaints that individuals were not allowed to wear masks when they went into someone's business because in our culture, when you're wearing a mask, you're trying to hide your face, and so therefore you might be up to no good. So there were still some businesses at the beginning of this process that did not want any face coverings as someone came in their establishment. Now though, however, you are to allow that to happen. And then you are to require your employees to wear face coverings. But these are the exceptions that I was talking about. There are some instances where it might be prohibited by law or regulation. I don't have a lot of good examples for that, but there could be some of those, and you and your industry and your business would know more about that individually than I would, and collectively. Also, if it's in violation of some documented industry standards, this is a safety issue. If it's a loud environment that you're in, particularly an industry type setting, you might find, I know we're talking primarily about retail, but if it's in a situation that this one alludes to, if it's a situation where if it's loud and you can't hear each other, you need to rely on facial cues and sometimes in reading lips even to some extent. So it could be a safety hazard to not do that. There are some groups of people that it's not advisable to wear for health reasons. People that are asthmatic, sometimes having a face covering can trigger an episode, as well as things like COPD, other types of lung issues that it's not advisable to wear a mask for. And these are the ones that it's real important to have communication. Hopefully if you have a customer that's concerned, if someone isn't wearing a mask and they might ask, if you're able to say, well, this employee is asthmatic, if that employee is comfortable sharing that information, But this is where the communication and the education, needs to be the enforcement, where you talk about why or why not something might be happening. So it doesn't lead to having to notify the health department and get us involved in getting you the letter and asking for response back, those type of things. I already talked about safety. This one is coming up, a functional or practical reason not to wear one. We're coming up into the summer months. Some of us have very hot environments that we work in, and it just might not be practical to have a cloth covering on your face that basically you would need to change often because if you're sweating or something. So there really might be a practical reason that it's not a good idea to wear a mask. And then if you do have employees that are working alone in a designated area and they're able to do their distancing of 6 feet or more, you wouldn't need to have a mask on. If someone comes to your office, you should put your mask on. Or if the person in the office does get up to go get some coffee or take a restroom break or something, they should put a mask on to walk around the facility. Okay, this is an example of some of the documents that we have on our website, Allen County Public Health .org, that you can download and place around your business if you'd like for your employees or in areas that your customers can see. Just some guidelines on how you should or shouldn't wear a mask. The key is kind of hearkening back to when I said we earlier thought it might not be safe to wear them at all. The key is you still don't want to touch the mask part very much at all, and you don't want to touch your face, your eyes, your mouth, or your nose very much. So you need to remove them and put them on by using the straps or the holes that you've made for how you are keeping it on your face, around your ears, or tied in a knot behind your head. So really try not to touch the mask too much. And particularly if you are taking the mask off to eat or something, you want to wash your hands after you have touched your mask. So I'm not going to read the whole flyer there to you, but just know that these sources are on our website. And I give you a list of sources here in a few minutes that you can refer to for a lot of good information about all these measures. All right, the second measure is for daily health assessments. And one of the confusions around this is, I think we've all seen on television news the segments of employees walking into a place of business and an employer is standing there taking their temperature as they walk in. Well, that's okay to do, but that isn't the requirement. The requirement is that a temperature is taken. So for instance, here at the health department, no one takes our temperatures as we come into work, but we all take ours when we get up in the morning and then at least once throughout the rest of the day, just to see if we are starting to spike a temperature, which is a sign that you are fighting some type of illness. So again, temperatures need to be taken, but they don't have to be taken by the employer. That is a little source of confusion. We get some calls about that, how employees will call and say, and my boss hasn't even taken my temperature. Well, it just has to be taken, but not by the boss. So other symptoms that people should be self-monitoring for, the three main symptoms of coronavirus are the fever, a cough, and difficulty breathing. Recently, the CDC has increased the list of potential symptoms to include things such as body aches, sweats, chills, and headache, and just general malaise or feeling tired. So if you have employees that are exhibiting a handful of these symptoms, then you certainly want to encourage them to contact their health provider for guidance on what they should do about their situation. Sick employees should stay home until they are free of fever or symptoms. I'm not going to read that to you. When this applies to you, definitely you need to look it up, but it's difficult to remember anyway. But the bottom line is there's time periods for when symptoms started, time periods for how long you've been fever free, as for when you consider yourself to be able to come back to work. Some of these guidelines have changed over the course of the 7 or 8 weeks because as we learn more about the virus, the quarantine period, the length of time a person can have the virus before they exhibit symptoms, those kind of things have varied a little bit. So occasionally the CDC will change the guidelines. So I wouldn't worry so much about memorizing these guidelines. Just know they're available, and when you're faced with them, know you can find them on either our website or the Ohio Department of Health's website, and then look at them more carefully, or call us for guidance. Another thing you might want to do is make sure that your sick leave policies are up to date and flexible. If employees have family members that are sick, and particularly if they are sick and have been diagnosed with COVID, then they might be in a quarantine situation where they shouldn't be at work. So are your policies set to handle that? Or do you have plans in place? Because that's sort of a, you have to weigh the value of, or weigh the two lesser of evils, I guess, if the employee continues to come to work, but they're carrying it, and then your other employees get sick and you're down a full workforce, versus just, are you down the one who should stay home even if they aren't sick? So those are some things you need to take a look at your workforce and make sure your policies can help address those things. All right, the third major practice to have in place is general hygiene. Clean hands save lives. We say wash your hands for at least 20 seconds, which we used to say sing happy birthday, but now everybody kind of has decided they want to have their own theme song as they wash their hands, I guess. So I've seen everything from Baby Shark to Stairway to Heaven. I've seen all kinds of different memes around that. So the point is just to use soap and warm water, wash, and then dry with an individual paper towel or an air dryer. You also need to have hand sanitizer available, particularly, again, as I said, as people are taking masks on and off. You need to use hand sanitizer in between those times. One thing that I didn't know about hand sanitizers before this experience was that third bullet there that says if you're using an alcohol-based hand sanitizer, your hands should stay wet for around 20 seconds before like the evaporation process happens, and that's how you know that you've used the right amount. I hadn't heard that before, but you definitely, and you want to start with it in your palm and rub it outwards. Don't just do your fingers, those type of things. So again, more graphics available on our websites. The fourth one is cleaning and disinfecting tips. Real basic information. Cleaning is different than disinfecting. It does you no good to disinfect if you haven't cleaned first. So you want to make sure you clean by removing surface dirt and grime and dust and those type of things that are sitting on top of surfaces. And then you want to disinfect with a spray or a wipe that kills the germs and viruses on the surfaces and the objects. One thing, just about every label you read will tell you that it kills 99% of the viruses or bacteria. So frequency of wiping and cleaning is just as important as how thorough you are. Because if it's only getting 99%, that leaves 1%. And if you're not cleaning often, then that 1% can grow quickly. So I don't know if any of you have been to the post office in these past 2 weeks, but they literally wipe down or spray and wipe down their surface in between every customer. So that might be the type of thing you want to make sure you have enough supplies to do that with if that's the course you take. And then some things that you want to make sure you don't forget about, if employees are sharing phones, taking orders by phone, answering, you want to have wipes available to wipe down the phones in between people that use them. Shared registers or laptops, however you take money in. If you've got a television that's playing in a waiting area or maybe even just a break room, you want to make sure you wipe down the TV remote, things that people touch frequently. Those of you who have company cars that people might be sharing, have wipes in there to wipe down the dashboard and the steering wheel. And then surfaces in the break room, refrigerators, and then doorknobs. We here at the health department have been leaving some doors open that we didn't used to, just so that we're not constantly having to turn knobs to walk in between offices or workspaces. When we open our doors back up to the public, we will have to close some of those back up, but that's just one way that we just avoid touching common surfaces. So that might be something you want to think about too. And then social distancing. I think we've all added this phrase to our vocabulary and used it and heard it more than we ever dreamed we would. But social distancing is the essence of stopping the spread of this virus as well as other viruses. You need to keep yourself away from other people. And the standard is 6 feet. So again, if you have a business that people are lining up at some point, you want to mark that off for them so that they have a place to stand. You want to perhaps rope off areas that if it's an aisle or a corner of the store or the establishment that there really is no flow through and people are like kind of backing up into each other to get in and out of there. You might want to rope that area off or just allow one person down that aisle at a time, that type of thing. I spoke about maximum capacity earlier, and again, that's 50% of what your fire code capacity is. And this slide is an example of what another sign that you can just print off from our website and post if you would like so that your customers can see it. And there's a lot of different variations for this. Some signs show how you can rope off an area or that type of thing. So make sure you visit those and take a look at everything we've got. Just to give you some orders of note and some dates to take a look at. You know, the first order, stay-at-home order came out back in March, March 22nd. And then I think it took effect like, 3 or 4 days later after that. All of these orders, they made a concerted effort to write them in language that you did not have to be a lawyer that studied contracts to understand. So if you have any question about where you or your business or your service fits in to governor's orders or health code orders, take a look at these 3 in particular. There have been dozens of orders, but these 3 were the main ones and are the lengthiest and cover the most and are more comprehensive. The first one, the first stay-at-home order is by far the lengthiest. And then shortly after that was the stay-at-home order that was amended with some tweaks on some things that weren't practical and that weren't working. And then the one that just came out last week, the Responsible Restart Ohio, then that allows for other businesses to start opening over the course of these 2 weeks, last week and then the 12th with retail. These are the websites again that you can take a look at, allencountypublichealth.org or coronavirusohio.gov. Coronavirusohio.gov is also one that you can really break down statistics a lot. We put statistics on our website as well, but the ones at the Ohio Department of Health can go a little bit deeper than we have the time right now to be able to compile confidently. Again, and then another slide with sources apparently. And then also cdc.gov has a lot of good graphics and signage and things that you can use for your establishment for both your employees and your break room. So, okay, I went through that pretty fast, sorry.
No, that's fine. I appreciate you jumping online with us today. And as Tammy had mentioned, please visit the websites. They got a lot of printable information there for you at allencountypublichealth.org in order for your business to post signage that's required. At coronavirus.ohio.gov, the governor has posted the regulations up there for retail businesses, what's required of you, and also for restaurants being able to open on May 15th for outdoor dining, as well as hair salons, which they're calling personal service, spas, hair salons, and barbershops, and then also more guidelines for restaurants to be able to do indoor dining the following week. So we will also post this on limanchamber.com. So if you have any questions, please reach out to the Allen County Public Health Department or the Lima Chamber. And then also, when it comes to your policies and your business plan, we also want to make sure that you are aware of the Small Business Development Center at Rhodes State College with Kathy Keller. And by all means, you can always contact her at 419-995-8184. And we appreciate everybody joining us here today. for Topical Thursday, every Thursday at 3:30, and we will see you again next week. Thank you, Tammy, very much for joining us today, and we'll talk with you soon.
Thank you.
Have a great weekend, everybody.